local on-demand economy a portion of the day. We're going to be having two panels, and I'll be joined in just a moment by the first. The first panel is going to focus on the consumer opportunities in on-demand. During the last year, we did a show in San Francisco on the local on-demand economy, and at the time the focus was really on what about employment is changing. The thing that we've realized is we've done our research over the course of the last 9 months since then, or 6 months since then, is that this is really a transformation of logistics and coordination. The ability to deliver both a service and customization of a service or product anywhere, anytime is a fact, or is a result of the fact that the enterprise logistics systems that gave very large global brands a huge advantage over the last 40 years as they perfected them are now percolating down to the rest of the economy. And as all the signals that we were hearing that we're going to be able to capture from football stadiums, from the iTunes or the Apple Store and so forth are factored into that kind of information, we'll be able to target very specific and very high value services and experiences we believe people will probably pay more for. The other thing we believe is that those supply chains will become examinable. That is, you'll be able to look into the supply chain to see whether or not it supports the kind of social outcome you would like as well. We hear a lot about social impact investing amongst large investors, but even individuals would like to be able to say, I want nothing made with slave labor. And that will become a preference that you'll be able to click and turn off all the offers that would include that kind of immoral contribution. So it's going to be a time for empowered consumers. And in our first panel, which I'd like to invite up now, we're going to look at how we're able to address in several key areas, but primarily in medical, the opportunity to provide services when and where they are needed. And so we're going to be joined by Nick Desai, Susan Dost, and, I like this, Chris Sullins. Nick is the co-founder of Heal, which is at getheal.com and based here in Los Angeles. Essentially, he provides a doctor and a physician's assistant on demand. Susan is the co-founder of Nurse at Your Door. And in contrast to providing a doctor, a nurse provides much more hands-on and long-term care in many cases. And so it's a very different set of services, but they have to be coordinated with doctor services over time. So I thought it would be interesting to bring the two of them together to talk a little about how those kinds of channel opportunities are going to be coordinated. And finally, Chris Sullins is the president and CEO of Workwave, a tool for managing fleet and deployment of your people and tracking and delivery of services so that they can be billed and paid quickly. So first off, I'd just like to ask each of you to introduce yourself and talk a little about what it was that made on-demand so compelling that you would start a company and where you are as a company.
Thanks, Mitch, and thanks for having me. I'm Nick Desai, I'm CEO of Heal. As Mitch said, we're a iPhone and Android app. It's on-demand or on-schedule doctor house call app. You hit a button, a board-certified family practice or pediatric doctor comes to your door. If you hit the on-demand button, typically in about 42 minutes from when you hit the button, 8 a.m. to 8 p.m., 7 days a week. We are both a cash pay and in-network service, so if you have PPO insurance, you don't actually have to pay any more than going to a doctor's office. The genesis of this idea was actually our own need to go to see doctors. My wife, who's our chief medical officer and my co-founder in this, and I had our first baby boy about 24 months ago. But when he was 7, 8 months old and he was having to go to the doctor for all his checkups, it was a huge pain to take him. And one Friday afternoon, he had a fever and a rash, and we couldn't get a hold of the pediatrician, and we're nervous first-time parents, so we took him to the emergency room and sat for 7 hours. Only to find out it was just a fever and a rash. And on the way home, we talked about creating a better way and using the on-demand sort of revolution to enable patients to get health care as easily as you can order a pizza, and to enable doctors to get out of the confines and sort of trappings of the hospital or office environment and see patients in their home environment.
And just quickly, where are you in terms of the growth of the company, and what are you looking to do in the next 6 to 8 months?
Well, that's it. Thank you for asking. Since I last spoke, I think in March or April, we've grown quite a bit. We now serve 5 California markets, from San Diego through to the Golden Gate Bridge, basically. 25 million people are in our coverage area. We have added all 5 of the major PPO providers in California, so we've doubled our paying customer visits month over month for the last 3 months. The big objectives over the next 6 to 8 months are to really win and own the California market, to continue to add vertical service integration so we can provide quality and continuity of care, and then to look outside of California at key strategic markets.
Susan.
Good morning. I think we're a nice complement to your business, by the way. I'm the founder of Sheridan Care. Sheridan Care is a company that's 14 years old. We employ caregivers, and that's how Nurse at Your Door came about. I'm the co-founder with Kelly Rosenberry, who's actually here, and is the nurse of Nurse at Your Door. So we're an on-demand app and web-based and call center for the ability to serve our patients through nurses. And it all came about through serving the geriatric community with Sheridan Care. And the continuum of care, we're big believers in people staying at home. We're working with chronically ill, geriatrics, pediatrics we'll be adding. We are a startup, so our app is live only at the Apple Store now. We have hand-delivered 1,000 visits, over 1,000 visits this year, not necessarily through our app, through many other different forms, mostly the call center. And 1,000 visits, we have $250,000 in revenue this year. So we're a bona fide startup, but we are well on our way to developing the app. Our big objective is to have a powerful software base so that the app is Android and Apple iOS usable. And from there, we will open it up to other states in the United States.
And Chris, your business essentially helps people coordinate these kinds of activities generally. Tell us about Workwave.
Yeah, so thanks. I'm Chris Owens. So Workwave provides cloud-based tools for field service companies and what we call last-mile logistics providers, which could include delivery companies like this. So I view us as kind of an on-demand enabler as opposed to an on-demand provider. We basically, our tools span all the organization. So our goal is essentially to help our customers in 3 big areas. So our customers need to get more efficient in the office. They've got to get more efficient, more visibility into the field. And then they need to kind of close the loop between what's going on the lead generation, the marketing side of my business, and how does that manifest itself once that comes into my operation, so that they can get to the kind of true ROI of what their marketing activities are and really expose things like schedule, which is important, to people who are shopping for services at that point in time. So we've developed this technology. The company's 31 years old, so we're old, but we're growing like a startup. Over the last, I joined in 2008, and since then we've grown the business 5x. We've got about 10,000 people, companies that are using our applications. And really the goal is to connect all the aspects of their business, serve up information so that at the end of the day, what you're doing is looking at the analytics and the KPIs to be able to make smarter decisions. And if you do that, you can provide better service, but you can do it efficiently, which is essentially what all of us are trying to do in the on-demand.
And so what industries are you currently most involved in?
So mainly, when you think of field service, it's pest control companies, it's lawn care companies, heating, air, and plumbing. So anybody with like a face and a big number on the side of their truck, delivering service. And on what we call the last mile logistics, it's really much more wide open. So food delivery, a lot of the latest kind of up and coming apps where you can order groceries or food online. We provide logistics for that. Home health care is a category that we provide. Package delivery, anything where you've got significant assets in the field that you really need to plan, optimize, and track efficiently.
So let's start with the traditional question on demand. 1099 or FTEs? What is the right way to go, in your opinion?
Well, we're in a unique situation where it's actually cheaper to pay doctors as FTEs than it is to 1099 them. When they work hourly shifts but don't have the security of a full-time job, they want more money. So for us, full-time is absolutely the right way to go. I'm not going to make a value judgment on anyone else. I think that there's a lot of people out there who do value the freedom of, being able to work when they want to. But doctors are in a unique situation where it's more cost-effective for us and provides greater continuity of care when we make them full-time employees.
Susan?
Yeah, I have 170 employees through Sheridan Care, so I know that model very well. We are excited to go the registry route for our nurses and go independent contractor. To begin with Nurse at Your Door, that's what we're doing. We just think the percentage is better for them. They'll make more money. There's a lot more flexibility being an independent contractor, much like the Uber model where you just press a button and go available. If California will let us, we'd like to remain as an independent contractor route for our nurses.
Yeah, so we don't care.
What do you
I
think your
think as an
customers think?
enabler, the same, I view on demand really is not 1099 versus FTE. It's really an experience that customers want. They want to be able to push a button and have people come. And whether the delivery of that model is through FTEs or 1099s, at the end of the day, it's kind of a business practice. Now, what I will say, given that we are heavily focused in field service, and there's a lot of guys that are trying to make 1099 work in field service, is I think that is going to be tough, and you see with HomeJoy and some others that it is tough. And the reason is, as we look at it, I think of it as kind of a 2x2, which is probably an oversimplification, but when you think of the frequency of service delivery, from low to high, and then you think of the kind of intangibles in terms of how important is a relationship with the provider versus more of a transactional or price-based relationship. So the more that the relationship skews towards high recurring, so think of a maid service, somebody coming into your home on a weekly basis, you don't really want that to be a revolving door of people that, supposedly got checked or whatever. You want to have that relationship, and that's inefficient to deliver through 1099. It kind of goes against that. So high frequency, high relationship. On an emergency service situation, so let's say you need a plumber and because you've got, your toilet just backed up. It's not a relationship thing. It's like, I need somebody now. Right. I want this to stop. I want somebody who's got great ratings and has been vetted and all that. But that may make more sense for kind of a 1099 situation where demand is uncertain, it's more transactional, and it's very important for the customer.
Well, and we agree with essentially everything you said, because what we're seeing is that when we've described everything as the Uber of this or that, there's an assumption of interchangeability of the provider. But of course, in healthcare, there's an intimacy involved that you're going to want to see at least the same nurse on a daily basis, or at least the same several nurses over the course of a week, maybe. Right. And on the other hand, the soft skills of the employee or of the person doing the delivery need to be in some way coordinated with the brand experience that you're trying to create. How do you engage and train? You have FTE, so legally you can do it. Right. How do you keep your docs ready to be a heel doc?
Well, so the one thing we do that was a very big sort of heated discussion within the company and the investors, but we went, I think, in the right direction, is we do not let you book the same doctor again. We specifically want your experience to be with heel and with a great heel doctor, and it's sort of what, not in the on-demand space, but what Starbucks has done so effectively. Every Starbucks is the same Starbucks, right? And people like that. There's a familiarity to that. Every Westin hotel looks and feels exactly the same. We don't want to get you into I have to have a relationship with this doctor to get great care, as much as I have to have a relationship with heel to get great care. And what we do is we don't train our doctors on medical care at all, because even with full-time employees, that's not allowed. They're great doctors. We train them on the heel way, what they wear, the lab coat, the equipment they carry, the what they come in, do they ask to take off their shoes, how they greet themselves. These are all matters of training that take a lot of time, especially when you think about doctors who are extremely well-educated people, but are not used to not having the home court advantage. Doctors always practice in their building, in their facility. You come into the waiting room, you sit, you're the guy with the pants off on the little blue piece of the chair thing, they have the upper hand, and now they're going into your house, and they might be afraid of your dog, and they might be, allergic to your cat, and they might not know your cultural customs, and we take a lot of time to train on those things, other than just the core medical continuity, so that every HEAL experience is a great HEAL experience.
And Susan, you have both FTEs, and you're looking at on-demand as a really significant opportunity. What's your thought on that?
I agree with Nick in that, the standard of excellence should be set, and every independent contractor or full-time employee should have the nurse at your door look, the feel, the kit, the whole bit. But we really are going in a different direction. We may come back to that because every day this on-demand technology teaches you something about your business, and each customer teaches us about how we act. We're an old-fashioned home delivery medical company integrated with technology. So we have to be very careful of how we do this. So we're developing in LA to get more traction, is neighborhood rounds. So we're in the Palisades one day. You're going to get the same nurse on Tuesdays and Thursdays as you are any other day of the week. And our software allows you to give feedback on a nurse. You pull up your history of visits. If you'd like to get that nurse again, you can send a ping to that nurse and ask to have that nurse come back.
Right.
So we like that. It's a relationship. We know that in home care, it's a relationship with the caregiver. It's a relationship with the nurse.
So a patient choice.
Patient choice
that
we're going to give them is, because we believe that'll be a differentiator. But there again, if we're running as independent contractors, they might not be available that day, but that's why we're testing out neighborhood rounds.
So, Chris, I want to ask a variation on that question, and it has to do with the integration of other data, such as sensor data, that you might use to deploy people appropriately. And I'll give an example that I just heard recently. A friend of mine is building a sensor that can tell when you're going to become at increased risk to fall as an elderly person. And the way that they do these sensors is we normally sit down and we settle into a chair, but older people, the last inch or two, they fall. That last inch or two can be measured by an accelerometer on a pendant or a brooch, and it gives you a very clear signal that this person's now at risk. Are you looking at how you would be able to possibly integrate with those kinds of services in order to be more specialized for instance, the healthcare industry?
Yeah, so I'll answer that question. I have one thought on kind of what we were talking about as well that I want to circle back to. But so in answer to that question, the answer is yes. I would say that, what we want to be is kind of device or input kind of agnostic, because I think things are going to evolve over time, and we have no idea if this is going to take off or something else. So in terms of what we're trying to do as a business, this connection of all the different aspects of their business, the goal is to surface information that they can use.
Right.
And that's one source of information that potentially could be valuable for people. So I would say it's not something that we're working on, today, because there's no use case for it, but it certainly would be in the realm of things that we would look at. Going back to kind of whether or not you provide kind of the same provider versus a different doctor, I think, again, obviously, on a company-by-company basis, and we see this within our own universe of people, even on field service, very different models. Some people, don't care. Some people do. All of them want loyalty towards the company that's providing the service, which is where some of the kind of models where you're disintermediating the company, it creates incentives for kind of the actual company wanting to work around the system and the provider to work, or the consumer, because they want that relationship, and you're trying to kind of keep them from getting it. So that's one thing to be conscious of. The way technology, though, can help, whether that's you want to provide kind of this same experience regardless of the provider versus same experience, same provider. is through mobility, obviously, and being able to give them the information they need. And we do that in things as mundane as pest control. They've got all the notes on the account. They know that they're supposed to close the gate on their way out. There's a dog in the yard. They have kids, and they're not supposed to spray in this particular area. All that stuff, whether I send technician A or technician B, can be surfaced through the app,
Sure.
And they can provide a similar experience. The other interesting thing that we do that I think can be helpful for providers is to assign or help you assign a cost to the way that you do business. So to send the same person every time, there's a cost to doing that because it's a constraint on your system from a scheduling standpoint. That person may be booked somewhere else, and now two people want the same person at the same time. You can't do that. And so our routing and route optimization engine factors all that in and allows you, as you say, okay, I'm going to assign a constraint here to look at what the impact on the schedule is. And then they can remove that constraint and say, you know what, if it doesn't matter who goes, now what's my capacity? And you may be able to serve 2 or 3 or 4 extra clients in a day because you removed a few constraints,
Sure.
Which can have a pretty big impact in terms of your efficiency of operation. And so strategically, then you decide kind of what's more important, from the customer experience.
Did you, okay. I thought you were signaling you wanted to say something. So that really leads in beautifully to the question I was going to ask, which is, as we've looked at the evolution of these companies, really the key business strategy is to find a process, understand it, map it thoroughly, cost it, and then start to optimize it and continually optimize that process. Now, Susan, you used the phrase a few minutes ago. You said, if California lets us, particularly in the medical industry, for both federal and state reasons, there's a variety of regulations which in one sense limit what you can do to change the way you deliver medicine. And on the other hand, there must be many opportunities in that very antiquated way of doing things to innovate. How do you guys approach that, and how does that regulatory constraint help you also provide continuity for clients at that first or second engagement where they're just getting used to having somebody come to them rather than going to get care?
Right. Well, I heard an interesting thing from someone I met having coffee is that, currency and trust go hand in hand in this on-demand economy. And that's very true with us, as people will pay. We are all strictly private pay. So we're $150. A nurse will come to visit you for 1 hour. It's not a visit, it's an hour. Whether you need a prescription or a full, treatment, we'll stay for that hour. So I think, we're very different in the way that we approach this because we're private pay. So I think that gives us a little bit more range. I think that eventually down the road, just because, Uber in California are not agreeing and that changing maybe the independent contractor route there, that might lead to other industries. But for now, we're going to stick to the private pay route and hopefully just as premiums go up, your health insurance premium goes up, are you going to spend more than $800 a month with Nurse at Your Door that you would have spent paying your premium?
Right.
It just isn't making sense anymore. And that gap with home health care, when a nurse visits you, if you've had a post-op experience, a nurse will visit you, she'll do her visit, she'll stay for 5 minutes and then leave and do her rounds. We're not like that. It's the old-fashioned touch, as I said, mixed with technology. That's a beautiful niche.
I think everything you said is absolutely on point, and I think that we try not to worry about the regulatory environment. We want to understand it and stay within its parameters, right? But and I certainly there could be a whole philosophical, political discussion about do the regulators have people's best interests at heart or special interests' best interests at heart. That's not interesting to us, right? What is interesting is that regulation has made medicine a giant pain to get. Right? And so it's not hard to be better than the existing system in healthcare, right? Everyone hates going to the doctor. Everyone hates the experience. Everyone hates going to an emergency room. Everyone hates going to an urgent care. And you only have to be a little bit better than that to be better than that, right? And that same regulatory environment allows us to serve people in a way. We have a net promoter score of plus 89. Okay, now that's a high net promoter score for any product or service. It's astronomical in healthcare. Kaiser's is plus 17. okay? We're 5 times better than Kaiser because, again, we're sending a doctor to your house, and it's the pain of, oh my God, the CDC, the United States Department of Health and Human Services, estimate that there are 1.5 billion times a year people should see a doctor but don't. And the cost of that to the healthcare system is about $300 billion a year, 10% of the total cost of healthcare. Because when I had a pain in my back and I didn't go to the doctor, 2 years later it turned into emergency surgery that cost $100,000 to my insurance company as opposed to a Medrol dose pack, which is like $25, right? So that delay is costing more money, and we look at that as an opportunity to look at the regulations and say, what are businesses stuck in doing, and what can we do, and what can we charge for? And I think the point about cash pay is a really interesting one. I read a data point yesterday, many of you know or probably don't know, but you should check. Starting 2016, the Affordable Care Act excise tax kicks in, which means your deductible is likely going up if you're on a PPO insurance plan from around $500 a year plus nothing for office visits to your first $2,500 is out of pocket. Okay, they estimate that will change out-of-pocket healthcare spending from 4% to 40% of all healthcare spending. Well, that's great. You know why it's great? Because it will drive consumerism in healthcare. Because if you order a pizza from Domino's for $6 and it doesn't show up perfectly and on time, you'll complain. You get your money back. But for a doctor, you'll go and sit there and wait 3 hours and just think that's how it's supposed to be in a dirty waiting room. But as soon as people start paying for things, they'll expect the American consumer experience, and that will force everyone involved in the healthcare system, nurses, doctors, facilities, clinics, practices, ACOs, and regulators, to create a system that serves the customer's expectations.
So let's a little more on the medical topic, and this also ties back into the management of the system. How do you anticipate the growing coordination of care that you'll be able to provide over the course of time? The two of you in particular have complementary services where a doc may need a nurse to carry out a certain procedure on a regular basis. They may just feel that somebody needs to be checked on in their home rather than moving them into a retirement home where it's going to cost 10 times as much to keep them alive. How do you see those, from your two perspectives, evolving over the next few years? Is this a slow conglomeration or roll-up of medical services, or does it continue to be loosely connected in the internet sense, where you'll all be sharing data which will allow you to coordinate services or allow consumers to decide how their services are delivered?
I think the EMR, emergency medical record, is going to play a big part in that. As we share your information, so for a nurse at your door to make a visit, we have to call your doctor. You have to put your doctor's information. We have to take your doctor's orders and provide the care. So we are building a portal for physicians. So concierge doctors right now will be able to upload all their information, and then they will be able to ask a nurse at your door to pay a visit to you based on your doctor's orders. So we will provide anything your doctor asks us to do. So it is an absolute necessity for a nurse at your door to partner with doctors. And that's how we get our orders, and that's how we can operate within that regulatory space safely. So we can't do one without the other.
Well, and I think, again, I think that the EMR, it plays a big role, and there's a manifest necessity for what you're talking about to happen, which is seamless care. I heard someone say the other day what I thought was a very true point, which is you get the best health care in your life when you're a little kid and your mommy is making sure you go to the right doctors and the right pediatricians or your daddy, and you get care, and they're the care coordinator, and they make sure every little thing that's supposed to get done is done, like I do for my kids, even though I don't do for myself, right? And the point of that is that that parent takes that human interest in that. So the flow of data, which is a manifest necessity and is a train wreck right now, because there are still doctors on paper, and there's some with EMRs, and EMRs don't talk to each other, and people don't know where their records are, and how do you get this mythical longitudinal health history that you understand the whole patient's health history. But the other side of that coin is the human continuity, so that if one time a doctor is coming and the next time a nurse is coming, and then you might have a physician's assistant stop by just to do your pill box refills and help you do your stretches for the day, or a care coordinator for a patient with dementia or whatever the case may be, that there's continuity. So you feel like that person, the person that you're interacting with, is completely aware of and enlightened to your exact health circumstances and can step right in where the last person left off. And I think that is going to take longer time to come, but it's an extremely important thing that consumers desire. Is they're confused and afraid of healthcare, and they want someone to take that mystery out and say, I've talked to all these people and I know exactly what to do next.
So, Chris, your tools are the front line. Are you also helping people be discovered and helping them market through the tools?
Yeah, so that's an evolving area. It's actually an area we're investing pretty heavily in right now because it's a hard problem. People spend a lot of money to try to get found, and they're having trouble attributing where those leads came from, how much they paid, and those kind of things. And a lot of times, because the systems don't talk to each other, and even when they do, it's on a pretty basic level. So as we kind of look at it, is really what the on-demand economy is really pushing towards is taking a lot of this operational complexity and pushing it into the front to where the customer is going to be able to see and use that in their decision-making process. Which exposes a lot if you're kind of not buttoned up. And so what customers want is an easy way to go and find out, is somebody available, and if they are, when are they available, how much does it cost, and again, they don't care 1099 or not.
But reputation matters.
Yeah, absolutely. And so trying to tie in to that experience, one, a really detailed view into the schedule where I know when I serve up times that I'll be available. Again, like in a doctor's office, a great example, you're coming into the office. There's no difference between an appointment at 10 o'clock and 11 o'clock or 12 o'clock in terms of how long it takes the doctor to walk from one office to the next. Like, you don't have to factor that in. On a field service visit, or now that you're going out to the house, it makes a huge difference. So you can't just show a slot and say, okay, well, I have a slot from 10 to 12, I'm just going to keep open. And you have somebody that picks that slot that's 100 miles away from the last slot, and it's just not going to work. And so being able to, yeah, exactly. So you've got, now there's a lot more impetus on the company to really make sure that they use tools to find out what's most optimal in their schedule, surface those for customers so that it's not a bad experience where they pick a slot and then somebody calls them and go, you know what, that wasn't available.
And so is convenience the first step with both of your initial customer engagements in many cases? Is it the fact that somebody can come, that it's going to save time, or do they stumble on it and say, I didn't even know that?
No, convenience is, for us, 62% of our first-time customers would have used an urgent care or ER, and the convenience of I didn't have to leave my house, or I didn't have to pack the kids in the car or drive while I'm vomiting, whatever the case may be, is a huge factor.
Yeah, definitely. Convenience is, Kelly's been a nurse for 30 years, and so she's been hearing for the last few years that we've had this startup, where have you been?
Right.
How is it not possible that I haven't heard of you before, where I can stay at home and have you come over.
Right, yeah.
And with hospitals, that the readmission situation is forcing us to keep them at home.
Yeah. Right.
So,
well, that's a great place to conclude. We're out of time. Thank you very much, Chris.
Thank you.
Susan.
great
and
job.
Thank you.
Thank you.